My name is Stefan Tarlow. I am an orthopedic surgeon. My background in medicine is that I went to med school at the University of Oregon Medical School in Portland. I stayed there and did my residency in orthopedic surgery. And then I spent most of the next year doing an extra year of training in knee surgery, both in Sweden and in Birmingham. From there I went into private practice, so I've been in private practice my whole career. And my clinics have always focused on the treatment of knee injuries and knee diseases. So what differentiates me from the other orthopedic surgeons in my area? I think the simple answer is that I focus on one joint. And so being a surgeon that just focuses on the knee lets me go through my head when I see a patient. How can I best treat this patient? Is it with rehabilitation methods? Is it minimally invasive surgery? Is it robotic surgery? Does this person need to be an inpatient? Can we treat them as an outpatient? And so I think my focus on just knees gives me a leg up on my competition, so to speak. I believe if you're going to be a surgeon, you need to dedicate yourself to lifelong learning. And that means staying current with things in your field and also become familiar with technologies as they evolve. And one of those technologies that has evolved in the last 10 years is robotic knee surgery. And so there is a robot called the MAKO Robot that I've been using since 2011 to perform partial knee replacements, and more recently using the MAKO Robot to perform total knee replacement. It's an amazing technology that lets us use our skill as a surgeon and our knowledge as a surgeon to say, how should this knee be put in, and combine that with technology that lets me be extremely precise as to how we put these artificial parts in people's knees. And the benefit is that you can reproduce the normal anatomy, and I think people end up with a more normal functioning knee as a result of my knowledge and this robotic technology. When do we use the MAKO Robot? I use the MAKO Robot for all of my partial knee replacements. And so whether that's the medial or lateral compartments, we quote, always use the robot for partial knee replacement. Not all total knees are being done using the robotic technology. And so as a surgeon, I decide who's a good candidate for a robotic total knee. So what's the most fulfilling part of being an orthopedic surgeon? Well, I'm going to give you the standard and corny answer, and it's helping people. There's nothing more gratifying than to hear from somebody, you changed my life, you helped me. And as simple as that may be, I think it's a very powerful message, and it really drives me in my practice of medicine.